the Student Health Center, and he's here to answer any medical questions or concerns that you have. And I think we'll get started now since we've taken quite a bit of time already.
Well, first off, I'm Toby Richard, or T.R. Hotchkiss. I'm here because I have AIDS. January 27th was when I was diagnosed with it, down in Dallas. My parents live up here. My father teaches statistics, which may be good or bad, I don't know. And I came up here to convalesce, get better. I've been here since February, probably 3rd, I think, since I've been up here. I have full-fledged AIDS, and feel free to ask me any question about it. I haven't gotten afraid of it yet. I guess that's enough. Go ahead, introduce yourself.
I'm Karen Phillips, and I'm a member of the AIDS Buddy Program. The Buddy Program is designed to train people to work with people who have AIDS, and it's some intensive training over a few weeks' time that you receive, and then you are assigned to a buddy, to a person with AIDS, and from then on, it's between you and your buddy what you can do for this person, from grocery shopping to helping them clean their house, to going for walks with them, to simply being an ear. Listening is very important. You can also be a part of helping with their family, helping the families deal with this and deal with the disease. And it's extremely rewarding, and I strongly urge people who think they might want to do this to contact the coalition, the AIDS Coalition, and we will be offering training up here in January, we hope. And Liz Rachin, the director of the coalition, can tell you more about that if you call the coalition.
Hi, I'm Dr. Patterson. I'm here just to answer any medical questions that you may have. We at the Health Center have been involved in a steadily increasing way with this virus since the early 80s. We have been a part of helping form the AIDS Coalition, which is a really valuable community resource that I would recommend to you for your energies and support. AIDS is a part of HIV, and AIDS is a part of every community. It is something we need to learn to live with and deal with, and it's good to see so many people here today talking about their concerns.
Well, I guess now we open it up for questions. Does anyone have any questions? Don't do this to me.
Really?
Yes.
I was wondering how many cases of AIDS we have seen at Iowa State University since maybe it's been recognized.
We don't keep a running stat on how many cases at Iowa State. Certainly there are AIDS within our community. Have been within student and staff at the university. So we just don't have a running total of our particular community. It's not a closed community, so it really doesn't quite open. We need to realize that AIDS in any part of the world is a problem for us here as well.
Yeah.
What kind of progress has been made on the cure for AIDS?
There is no cure at this point. There will be at a later date. But right now we're kind of at a plateau. We know what causes it. We know how to prevent it. We don't really know how to cure it yet. We can slow it down a lot, but I will always have AIDS.
The question is progress on cure. Agree very much with what Toby's saying. There will never be a cure once the virus is in the system. It's not expected that will happen. Research is aimed at methods of prevention, immunization, and at dealing with the secondary infections that this virus causes to prolong life and hopefully turn it into a chronic disease rather than one that has historically been fatal.
Yeah.
What are you doing right now? I mean, are you working
Right now, I'm on Social Security and Medicaid. She wanted to know what I'm doing now. Do I have a job? I'm on Social Security and Medicaid is how I make money to pay for the car and gas and all that kind of stuff. I try and do some freelance things, but that doesn't always work. I live with my folks, so I'm getting room and board. I have everything that I need. I don't have wonderful luxuries and that kind of stuff because I can't work. I can only put in maybe 3 to 4 hours of work a day. I found that out when I was doing registration the other day, and I was one of the fee assessors. And after 4 hours, I was ready to go. It was kind of hard to do. So that's one of the things that AIDS will do to you. It really slows you down a lot. I got through that day, and I could probably get through others, but that's the liability of AIDS. It just slows you down. Yeah.
Sounds like you're getting good support from your family.
Yes, I am. Excuse me, I'm going to go in and out of crying because this is, if anything, it's a very powerful emotional kind of feeling that I've been living with my folks for 9 months. Sometimes that's good, sometimes that's not. Yes, they're very supportive. They're very kind. I have my own room, so I've got everything I really need. And now I also have time to go out and do these kinds of things, to do things like in stitches, so that I can provide something and give a return to people dealing with this crisis. Someday there will be a cure, but right now there isn't. And right now I'm doing everything I can to make the burden lighter for people. I can give some help. We've raised some money. In Stitches has raised over $4,000, which will go to getting this quilt here, which has gone to get this quilt here. There's a number of interesting panels that I see. But that's it. That's the job I have. Yeah.
How do you feel physically? I know someone that has AIDS, and it's really hard to watch a person when they're really tired and they can't eat. And how do you feel like physically? I don't know what stage you're in.
She wants to know how I feel physically, if the AIDS is catching up with me and draining me more than it should. It all depends on the day. If I'm working hard or I'm involved in something that is of interest to me, I'll work hard on it, and it just drains you. It's like doing registration. I should have been able to put in 8 hours, but even just working on a computer, and all I was doing was handwork, I got tireder and more cranky, and eventually I quit for the day. I got done with it. But it is a very draining kind of disease. It takes all the energy out of you.
Back there.
How did you find out that you had it? Were you just symptoms that you knew you should go and get checked or how?
I was living in Texas at the time. She wants to know how I got it. And was going to work back and forth, all this kind of stuff. I was temporary. And I began to get this kind of upper respiratory ailment kind of stuff that you get every winter. And I thought, well, all I have to do is take a hot shower and go to bed early, and in a couple of days I'll be fine. Well, I wasn't fine. I developed double pneumonia. And I sat there for about a month. I went to the doctor and he kept giving me these antibiotics that didn't do anything. They just kind of made me ache and feel funny. I'm experiencing whole blanks in my head. Every once in a while I get to a spot and I have to figure out where I've been. how I got it. And then I collapsed. I ended up in bed. I couldn't get up. And so eventually I called the ambulance and they came and got me. And I spent 4 days in Arlington Hospital in Texas, to the tune of $12,000. If nothing else deters you, don't get AIDS because it's expensive. It really costs a lot of money. And since then, I have had meningitis, spinal meningitis, and that was 8 days for $8,000 here in Ames. So I'm not going to see the end of this bill. I will forever be. I've always got a new cure coming at me. There's always something new that's found out, or something to take care of an ailment, and you got to pay for it. Let's see. I guess that's it. That's how I contracted it. I got over it quickly, or at least I got over the symptoms quickly. I beat the pneumonia as soon as they gave me the right medicine, and the same thing with the meningitis. I got the right medicine and was fine after 2 or 3 days. I have this little thing here that they feed me intravenously with this. When it gets really bad, if they can just give me a shot, that's fine. But I had the meningitis I had to take intravenously for like 6 hours. And this stuff was shrinking my veins and closing them up. So I get halfway through the treatment, and the thing would stop. Nothing would happen. So they put this thing into me, and it works much better. If you ever have to make a decision, go ahead and go for this, because it really makes a big difference. It helps. But otherwise, this is the only thing that's really happened to me that I've had to get operated on, and medicine, that kind of stuff. This is the biggest change that I've had to this point. Yeah?
You talked about cost. Do you have insurance?
No, I didn't. Working as a temporary, when you get into that position, they want to know how much it cost, and if I had insurance. No, I didn't. I was temporary. As a temporary, you work when the job comes along. You don't get paid or any kind of money in that nature. I was a good temporary. I usually worked 20 hours a day and 40 hours a week. I very seldom had a vacation. But by nature of the beast, if you weren't working, you weren't making any money. And I didn't have money to spend on insurance. I just didn't have the money. So that's how I ended up in this position, kind of flat on my back in a way. Although some good things have happened from it. I've met many more friends, many more people that have been worthwhile. There's a flip side to every coin, I guess. There's been some good things that have happened from it, and some bad things. The bad things are the poverty and the hard luck. But then the good things are the friends that I've met, the support that the community can give you when it has a mind to. Sometimes it gets kind of tough. The people aren't that willing to help you. But then there are times when somebody will just come barreling out of their house and say, "Come in, I want to give you a meal," or whatever, that will show you some kindness. That's kind of what we live for now that we've got AIDS. You have to think of those things. Yeah.
Tell us about your response to hearing the news of Magic Johnson.
Well, yeah, they called me. Somebody wanted me, how did I find out about Magic Johnson and how did I respond? Someone called me on the phone just out of the blue, and Magic Johnson has AIDS. Would you care to say something or talk a little bit about it? And I did. I talked over the phone a little bit, told him how I felt. It's unfortunate when anybody has AIDS. It's a tragedy. And it really is very much too bad that Magic Johnson has AIDS. But I haven't been very active with sports. And so when the president came out and said, well, I want this disease to be cured before he actually gets it. He's only HIV positive. And I can't help but think back, at least it's been about 10 years, right, Karen? Why wasn't I important enough then 10 years ago? Why does this basketball player get priority over me? He's not that much different. He's not that much better. It's a tragedy he's dying. I really feel sorry for him, and that's too bad. But sometimes we need to get our heads on straight and decide what is important and what isn't. It's everybody's tragedy that they are dying from AIDS. And just because you're a big deal basketball player doesn't mean that you get an extra life or whatever. It's too bad that it's happening, and I commend him for saying that he's going to do what he's going to do, to work with AIDS people, to educate them on safe sex, all that kind of stuff. That's great. That's wonderful. More power to him. And I'm not really angry at Magic Johnson, but I'm a little bit angry at our society and how they pick up on certain types of people and not on others. There are hundreds, thousands of people that are dying from AIDS every day. And yet, President Johnson wants it cured before Magic Johnson gets it. It just kind of...
There's a question here.
Yeah.
Would you go into, or the doctor, into the preventive methods other than just the term safe sex?
I'll let you handle this.
Well, safe sex is one has to be able to talk about certain practices. Any practice that exchanges body fluids between human beings, whether that be IV drug use or sexually, puts people at risk of acquiring the virus. So in sexual encounter, it means wearing condoms, using dental dams. We must always keep in mind that not all sexuality is intercourse. There are many ways to express sexual affection or attention without it being intercourse. And it really boils down to don't exchange body fluids, whether that be sexually or intravenously with IV drug use. I would also add, we said people are dying all the time. In fact, in the United States today, a person is getting the HIV virus every 15 minutes, or every minute, and a person is dying every 15 minutes.
How effective are condoms? I agree that Oxford-9 does not kill the AIDS virus, it only kills sperm. And that the AIDS virus is small enough to get through condoms. So I don't know how effective.
The question is, how effective are condoms? This young lady has heard that non-oxidil 9 does not kill the virus, it only kills sperm, and that the virus is so small it can get through condoms. Studies that have been done found that non-oxidil 9 does help destroy the virus. This virus is not as small as some other viruses. It will not go through a latex condom that is intact. Non-oxidil 9, of course, has been around for a long time as a spermicidal. It's very effective for killing sperm. But to the larger question, how effective are condoms, it really comes down to how they are used and stored. The use of a condom is not a gift of knowledge that we're born with, and it's an acquired skill, and it behooves all of us to learn how to keep them and how to use them properly. There is potential of breaking and putting people at risk. And there again, one needs to be a little careful about the product of which you're buying, that it be of good quality and will perform the way you want it to. So it is, condoms are useful. for AIDS as well as other sexually transmitted diseases. And they're one of the better, if you're going to engage in intercourse, they're one of the better things to be using.
Yes.
How long is like comparing the HIV or the AIDS? How long does it remain in your body before they'll actually show up?
Well, I'm not a scientist. Isn't it 10 to 15?
Depending on which phase you're talking about, you can be infected with HIV, and it won't show up for 6 to 12 weeks, I believe, is the time period. So you could actually get tested the day after you were infected, and that test would come back negative. So it's always recommended that you get tested again in 6 weeks. So careful with your testing.
I'm not really going through any counseling. I am with the coalition, and they're helping me. They help provide me some funds through the Medicare and Medicaid and Social Security. And I have, in turn, helped them with projects and that kind of stuff, like this. If I wanted counseling, I probably could get it. I probably would get a buddy like Karen that would just kind of be there for me. I don't know, are they qualified to give super duper psychological?
No, but he's not qualified to give psychological counseling, but we do refer to people in the community who do this kind of counseling specifically. And we're fortunate here in Ames to have quite a roster of people who are extremely well trained in psychology and in counseling to counsel people with AIDS and people who are HIV positive.
Yes.
Are you on AZT and have you any reaction?
I'm on AZT and I haven't had any bad reactions at all. I'm on like 5 different drugs: the AZT, the Zovirax, and 3 more. I don't remember what they're called. I'll just take them. And as I mentioned, it's an expensive disease. AZT pill is $2 a piece, and I take 6 a day. So that totals up to $300 a month. So, yeah, hands go up now. Yes.
For people like you're living with your family now, for people say, or even in your situation, I don't know, talk about problems. For people that are alone with the disease, are there resources for them to go to get help paying these bills?
Yeah, go ahead, Karen.
Yeah, it's a mountain of red tape, and of course we're still fighting the system a lot with this because a lot of people don't want to help. And I'm saying people, I mean government systems. We need a lot of rules and laws changed in the next little bit to get people whipped into shape. We currently are dealing, and we have dealt with in the past, some people with AIDS who are homeless, and this is an incredible extra burden on them. First of all, being homeless and the ordeal one has to go through dealing with that, and then to have AIDS on top of that. But we have them here in Ames, and there are systems in place to help them. Not very good systems, but there are some to help.
Oh, no, I'm not. I just wouldn't feel comfortable. I could... she wanted to know if I was sexually active now that I know that I have AIDS, and I'm not. I just wouldn't feel right having possibly given the disease to somebody else. Putting them through what I'm going through. It isn't the right thing to do. So no, I'm not. It's not pleasant, but I kind of keep away from it.
Question.
Yeah.
Have you noticed a dramatic difference in your health since you started taking the AZT and the other drugs?
Yeah, somewhat. She wanted to know if I have had a dramatic change in health. Yes. I'm more tired more often. I've had a run-in with spinal meningitis, which hit my spinal cord in my head, and one day I woke up and it was hard for me to handle small sentences. And then by the end of the day, I was having problems doing one-word syllables. So that's when I ended up in the Ames Hospital for a week, taking some intravenous IV stuff that goes through. So yeah, there's been health changes, precautions, things to watch out for.
But you don't feel like the AZT has helped you?
It's hard to tell. It's one of those preventative medicines. It may be and it may not. I think that it is. I think it does make a difference. I feel a little different when I don't take it for a day. If I've gone out of town and didn't take my pills with me, then I can feel that something's wrong, something's missing. But other than that, that's about it. There haven't been any dramatic changes because of the medicine. I'm doing pretty well with what they give me. Yes.
Medicaid paying the cost of your AZT?
Yes, Medicaid does pay that. Because I was a temporary and I was earning so little money. Even though I personally was being paid like $16 an hour, I was only taking home 10. So that's where my insurance is. It's quite a racket, but it gets you through when you need it. Yes.
Have you had to deal with friends, death of friends from AIDS, and could you talk about that experience?
She wants to know if I had to deal with the death of friends with AIDS. And yes, I have. I know probably about 10 or so people that have died from AIDS, having contracted it, or been disabled, whatever. And it's not easy to do, especially it's not easy now that I've got it. It makes you think a little bit harder. AIDS is such a sad disease, and it's such an inevitable one once you've got it. You can't get rid of it. You can't get over it. You can keep it at bay, which is what I'm doing with a lot of my medication is what that is for. AIDS kind of slows everything down. AZT will slow the process down for the cure. It takes a little bit longer time for AIDS to take over then. I've got something called Bactrin, which keeps me away from pneumonia, but doesn't cure me from it. I will always have a tendency to have pneumonia. Same thing with the spinal meningitis. I take a pill every day to make sure I don't get it this afternoon. And some of those pills are not cheap. Believe me, it's incredible. If anything needs to be changed, it's the price for the medication, that kind of stuff, because that's what really sets you back. I think understanding is coming for AIDS, that people are beginning to understand what is involved and what you have to do and what you don't have to do to get the disease. The unsafe sex, the exchanged needles and exchanged body fluids. Those are the 3 ways you can get it. Those are the only 3 ways you can get it. So in some ways, AIDS isn't an easy disease to get. You have to go out and search for those 3 things. But then again, once you've got it for good. And right now, they don't have a cure. Yeah.
This question is from the doctor. Tony alluded to the fatigue that he experienced, and we all know that AIDS affects the immune system. And I was just wondering if you could tell us what are some of the other symptoms or warning signs that you may have before and you may have.
The question is, what can people look for that would indicate that they have the virus? In some instances, early on after contact, people will have what is known as viremia, which is kind of a mild cold and is really not symptomatically separable from the flu or upper respiratory infections, other virus infections. That's transient. After that, the body has developed antibodies, and after that, you can detect that the person's been exposed. But that individual may go years, absolutely 8, 10, probably longer years, and have absolutely no other symptom that they have this virus within them. They're healthy, well, sexually active, leading normal lives, and spreading the virus because it's still very much within their system. The early symptoms of advancing illness are weight loss. In Africa, it's called the wasting disease. It's diarrhea. As Tobiad, he presented with pneumonia, fatigue, night sweats, those types of things that just indicate failing systems. But the important thing to remember is that people do not know in most cases. Most people with this virus do not know they have it. And I think that's the fact that this celebrity let it known recently that he had the virus, hopefully will alert the people that there are a large body of people in this country and tens of millions in the world who are at risk or who have the virus.
You spoke of friends that you developed, friendships you developed since contacting the disease. What were some of the reactions you faced with the friends you had before, prior to the disease, and the reactions that you had?
Asking about reactions of family and friends. Most were very positive. Positive in that they didn't shun me or try and avoid me. They were concerned. They wanted to know how I was and how I was doing and all that kind of stuff. I didn't notice. There were some people that freaked out and didn't know what to do and just kind of avoided me, and eventually we parted company. But most people have behaved fairly responsibly. There's been a change within the past 5 years, of people knowing more about AIDS and knowing how to function with it, how to deal with it with somebody else if they've got it. There's more understanding involved. And it's better this year than it was last year, and it'll be better next year. People are beginning to understand and become isn't so much tolerant, but a little more understanding about what's happening to you. So nobody's really done me a dirty deal or anything like that or made me feel bad. I feel bad enough myself just having it. And most people realize that and are they're more interested in helping and giving you support and just trying to make what's left of your life as positive as can be. I guess that's it.
Back here.
Medical hygienists.
Well, I'd like to comment on that. I think that has been turned into some fantastically negative political garbage. The risk of getting AIDS through healthcare workers or dentists is infinitesimally small. Now, the response that has been made politically to that is that we're going to test all healthcare workers. Okay? How often are you going to do that? You can test me today. Tomorrow I might have the virus. How often are you going to test the tens of thousands of people that are giving health care in this country? I think that's an issue that has just been turned totally upside down. The Centers for Disease Control have developed very extensive guidelines to be followed. And the profession needs to follow those, and people who are in contact with the profession also need to expect that. Pardon? Sure.
Okay, go ahead.
I think it's going to turn into a witch hunt. It already has turned into a witch hunt in some states, and I think it's a shame, and I agree with Dr. Patterson that it's blown way out of proportion, and the likelihood of any of us getting it from a healthcare worker is slim and none.
I think you should be more in control of your life. While you need to put your health in the hands of the physicians and care people, you need to have a little bit of intelligence about you too, not to get taken in or sucked in by these gossip rumors that fly around. You need to know what is and what could be, and then make decisions based on that.
The other dimension of that I think is extremely important, if in fact we're going to be testing all healthcare workers in this country, the healthcare workers are going to soon demand that all people whom they come in contact with also be tested. That is something that has been effectively and properly resisted to this point, but I think that's, we better be careful what we're asking for. In fact,
When you went into the hospital for AIDS, did you tell them you had AIDS? And if so, did you think that animosity through it?
No, I didn't. I think I'm not sure if there's an actually a ward up there, but there is a care facility regarding AIDS. I wasn't so much isolated, but I was definitely in a place where the AIDS people went. The treatment and care I've received at Ames has been very good and very solid and helpful. And they're very rational about it. They aren't running around with panic and that kind of stuff. And I was not the only one that they've had. There have been several that have gone through there and had received their care. A lot of the care just comes from being nice and pleasant and glad to see you're here kind of thing. Yeah.
What is the test like, and are they like, can you go to any doctor's office and everything, or go to the specialty tests and things like that?
You want to take that one? I'm not sure.
I think there is some, the question is, what's the test like and can you go anywhere to get it? I think one ought to use a little pre-thought about getting the test. Yes, it is available many, many places, but the difference of the type of test varies. There are testing sites in all states, and Iowa has, I think, 14. The health center on this campus is one of them. We are able, under a federal grant, to give anonymous, free testing. So it's possible just to come in and, without giving your name or identification, receive a test. Those that are received in private offices or in hospitals, and for which you're going to pay $40 to $50 for the test, will become a part of your permanent medical record. And I think that some pre-thought need to be given to that. The other local test sites available is at the Public Health Service in Des Moines. The Polk County Public Health Service also is a testing site.
Just an added note, if the test even becomes a part of your medical record, even if it's negative, an insurance company can look at that and think that you're in a high-risk group and not cover you. So even if it's negative, it's not a nice thing to have on your record.
Yes.
Is it not true that in this country it's been focused mainly on gays getting it, or worldwide, did I read correctly, the majority of the people are from heterosexual
very true. It started out here in the United States with the gay population, but it's since been found that the heterosexual, the entire population, in fact, the population that is increasing the most is heterosexual females that are of childbearing age. So our future is in jeopardy. Our childbearers are no longer, they're at risk. Yeah.
In general, how long is one expected to live after being diagnosed with AIDS?
It's different, depending on the person. I've always been very healthy and never had a cold in my life, and that's served me pretty well up to this point. I haven't had anything really bad happen to me. Other people may have some sort of disposition to it and go under within a year or two. It really all depends on how you're made up and what kind of physical exercise, what kind of a healthy life you've led up to that point. Yeah.
Great.
How are other countries dealing with AIDS patients and those who have tested positive for HIV, specifically in a research context? It seems to me we ought not to double expend resources buying the efforts, if that's a possibility.
The question is, how are other countries responding to this virus, particularly in a research model? Well, there are many parts of the world that have the highest incidence of this problem, whose healthcare dollar doesn't extend beyond $8 to $10 a year per person, and a single test can cost $20 to run. So many of those countries are approaching the problem with total looking the other way, ignoring it. There are areas in the world that are doing a tremendous amount of research, and particularly Europe, and particularly in Europe and France, are doing a very effective research, and yes, there is cooperative effort between those companies. There's a great effort to develop vaccines or an effective preventative. Beret?
Which effective methods are working more? They're working more towards the C4 protein that helps us as far as preventative towards
The question is, what are they working for more, toward the helper T cells or the C4 protein type coverage? In fact, the vaccines that are now in clinical trial are aimed at several different areas that are felt to be vulnerable for this virus. And many of them are conceived in totally different ways. So there's a whole breadth of research going on that hopefully in time will pay off. But we must keep in mind that if we have in a laboratory today the effective vaccine, it's probably going to be 10 to 20 years before we can begin to see effective application of that. The whole issue of who's going to be used to be testing the vaccine is a big one, and right now the third world is being targeted for that. The answer to your question is that the research is really going on in all areas. This is a potentially vulnerable virus. It's not like any other normally functioning cellular physiology. So it is vulnerable. We're going to find something for it.
Yes.
Tony, how did you personally feel about being a quote name thing for a new? Somebody approached you and said, "I have what I feel is a cure for AIDS." How would you personally feel about being with that cure? How would any other people that you know that have AIDS feel about being used as the test model for it?
It would depend on on the numbers, on whether or not I would be cured or I would feel better after it. You can take all sorts of cures and nothing happens. If I was fairly well assured that I would have results from it that would be positive, then I would consider it. But I'm not going to waste my time getting pumped full of needles and that kind of stuff to have nothing happen, which I've had happen. So, yeah.
Wait,
Yeah. Oh, yeah, you got it.
The question is, perhaps already heard it, what makes one person get the full syndrome of AIDS and